This demonstration describes Mackenzie hyperextension exercises, which are great for treating disc problems. As always, this is just a general demonstration. You should have clearance by a trained healthcare provider if this is safe for you to perform. All right, so you're going to start by laying in a flat surface, flat, firm surface, laying face down. Now, if you're having an acute episode of pain, again, if you've consulted with a trained physician, this is an appropriate exercise for you to perform. You can slide, so you don't want to go very high in this exercise. We're going to show the safest mode or range that you can use this exercise. So may I have you, so first you're going to roll one forearm, bent forearm under your chest. Good. And then you want that under you as much as you can towards your center, and then slowly you're going to slide the other arm forward. Now, excellent. Like both of them, you want them closer to your center line. Slide them, okay? Like a little bit more forward. Thank you. Excellent, like that. Very good. Okay. Now, if you're getting any leg pain or worsening leg symptoms doing this exercise, then stop. It's not safe to continue. But most people should be able to tolerate even the slight minimal extension that's happening right now. Extension is a slight increased arch of the low back. So if you can get there, if you're having some tightness and discomfort in the low back, we can tolerate that. Again, to emphasize, we do not want any increasing or worsening leg symptoms. If you have any existing symptoms, the idea is you want them to centralize towards the back. You don't want symptoms starting or worsening going further down towards the leg. So if you can get in this patient safely without any worsening leg symptoms, or without the appearance of any, if you're not having any already, then it's safe to continue. What you want to do is gently suck in your belly button, flattening your tummy. You want to draw your belly button towards your spine. Okay. Now, for some reason, half of my patients, when I instruct them to do this, they do a plank. Can you demonstrate a plank, Bob? So you don't want to raise your hips off the table. So this is the wrong way to do it. So you want your hips on the table. So we're not doing a plank. We're just sucking into the belly button to create some suction and traction in the low back. And the traction is going to come in the following steps. So using your elbows as fulcrum, you want to gently pull your elbows towards your hips, your abs. Now, once you feel your belt move, you stop. You want your lower body to be dead weight, and you basically want to traction your upper body towards the wall in front of you. Okay? And you hold it for 20-30 seconds. Okay? So what we don't want to happen, relax for a second, Bob. Thank you. So again, we're going to suck in the belly button. So the wrong way to do this is if you're going to either jerk fast, which you don't want to do, or what Bob just demonstrated when he pull again, Bob, forward. You don't want your whole body to move. Relax. So you don't want the whole body to move. You want the lower body to stay dead weight. Slowly and gradually start pulling with your elbows, and you just want to separate just your upper body in relation to your waist. And just forward, hold the tension there. Now, you don't want to pull too hard. If you're getting any sharp pulling pain here, ease up a little bit. You want to feel things gently. This is your lower body, this is your upper body. You want to feel a slight decompression. It's not going to feel like a big stretch like when you stretch your hamstring or another muscle. You're just basically separating the upper body from the lower body. The idea is you want the extension, which is slight arch, and the opening up creates an environment to decrease pressure in your disc. So this is a great exercise for lumbar disc herniation with or without sciatica, which is the leg pain. Again, if you're getting worsening leg pain, you do not want to continue. Stop. Okay? So this is great. Thank you, Bob. You can relax. So this is for an acute pain. You want to keep the angle very low. Now, Bob, can you please slide your arm forward? This is about a halfway point. You want to relax down more, please? Sink through your shoulder blades. Great. This is kind of a halfway point, more commonly utilized for this exercise, the way I like to have it performed. And again, you're going to suck in the belly button and using your elbows as a fulcrum. You're going to pull the elbows towards your belly button. Again, hips and belt, dead weight here. We're going to traction our upper body forward. You do not want to push up. Can you demonstrate up, Bob? Yeah, you don't want to do that. Okay, relax. The hips stay down and you're pulling forward. Okay, the extension is made by just leaning on your elbows. Now the furthest angle you want to create is, can you slide your elbows forward just under your shoulder? Relax too high. Thank you. Okay, you don't want to push up again. All right. So you're just where your shoulders, your elbows are under your shoulder. Further than that, you can't support your body weight enough. It's going to be too much of an arch, uncontrolled, and especially if you're having an acute episode, I do not recommend doing it that way. Okay. As always, gently suck in your belly button, and you're going to gently pull the elbows towards your hips. And once you feel the belt moving, you stop.